Duloxetine is a well-known medication, popular with its brand names like Cymbalta and Drysalma Sprinkle. It belongs to a group of medications called SNRI, serotonin, and norepinephrine reuptake inhibitors. It is available as capsules, and it is used for treating a variety of central disorders. Even though it is introduced for treating depression, it can control neuronal activity and can be used in many conditions. Along with wide clinical uses, this medication can also cause many effects on your body, including the liver. In this video, we will explore key facts about duloxetine, like how it works, what is its effect on liver, what are common side effects, how to take this medication, and what are the important precautions. Clinical uses. One of the clinical indications of duloxetine is in the treatment of depressive disorder. However, it can also be used in other conditions. Duloxetine can control worry and agitation in people. Therefore, it is used to treat generalized anxiety disorder, commonly known as GAD. It involves a state of anxiety in people without any clear reason or inducing factor. In such people, anxiety may persist for longer than 4 weeks. Duloxetine can also be used to control a few pain conditions associated with neuronal stimulation. It can be used to relieve symptoms of diabetic peripheral neuropathy. This condition involves abnormal sensations like pinning and stinging. Duloxetine can modify neuronal excitation and control this neuronal pain. It can also be used to treat musculoskeletal pain and fibromyalgia. How to take this medication? Duloxetine is available as capsules for oral administration. You can take these capsules either with or without meals. However, it is always better to maintain the same time each day to ensure smooth levels of this medication in our body. These capsules release medication gradually throughout the day. The content in the capsules is specially coded to bring slow release of medication. Therefore, they should not be chewed or crushed. You can take these capsules as a whole with a plain glass of water or fruit juice. If you have difficulty swallowing, you may be given duloxetine sprinkle capsules, which can be opened and whose contents can be sprinkled on 15 milliliters of applesauce. Duloxetine capsules are available in different strengths: 20 milligrams, 30 milligrams, 40 milligrams, and 60 milligrams. The dose suggested for you depends on the purpose of its use. It is always started at a low dose, and it is slowly increased to a target dose. For treating neuropathic pain or anxiety disorders, the target dose of duloxetine is 60 milligrams per day, given in divided doses. However, for treating muscular pain and fibromyalgia, it may be given initially at a dose of 30 milligrams per day. After 1 week, the dose may be increased to a target daily dose of 60 milligrams. Similarly, for treating depression, the target dose is 60 milligrams per day. However, the dose may be increased based on the response with a maximum dose of 120 milligrams per day. How it works? Once you take duloxetine capsules, they can reach their peak levels within 5 to 10 hours. Its main site of action is on your brain, and it is rapidly distributed. Duloxetine works by elevating the levels of a few monoamines in your brain. It can increase the levels of chemical mediators like norepinephrine and serotonin. For treating depression, a group of medications called SSRIs can be used. They increase serotonin levels in the brain. Similarly, another group of medications, NRIs, can work by increasing norepinephrine levels. Duloxetine can have dual action. It can increase the levels of both norepinephrine and serotonin. This can be achieved by inhibiting their reuptake transporters. On the presynaptic nerve terminals, a few transporters are expressed. When chemical mediators like norepinephrine or serotonin are released, they can be taken back into the presynaptic neuron through these transporters. In case of norepinephrine, it is called NET, norepinephrine transporter, and in case of serotonin, it is called serotonin transporter. Duloxetine blocks these transporters, which increase levels of norepinephrine and serotonin in the synapse. This improves their transmission and relieves the symptoms of depression. Duloxetine can also elevate levels of dopamine to a small extent. Side effects. You may have sleepiness and dizziness with the use of duloxetine. It can also produce dry mouth, nausea, and weakness. In a few people, it can cause constipation and even loss of appetite. Sweating, blurred vision, and loss of sensation are also observed. Effect on liver. Use of duloxetine may affect your liver. It has the risk of inducing hepatotoxicity. Therefore, it is not recommended for people with liver dysfunction. Duloxetine can elevate liver enzymes significantly. Therefore, the development of a few symptoms like abdominal pain, jaundice, and liver enlargement may indicate a serious effect on the liver. In such cases, immediately the drug should be discontinued. Serotonin syndrome. Duloxetine can elevate the levels of serotonin in your brain. When their levels are excessively elevated, they can induce a few symptoms like rapid heartbeats, muscle spasm, elevated body temperature, anxiety, sweating, and tremors. They are collectively called serotonin syndrome and mainly precipitated when duloxetine is combined with a few other medications that increase serotonin levels. For example, antipsychotics, serotonin precursors, and triptans may precipitate the syndrome when they are combined with duloxetine. Orthostatic hypotension. You may observe a drop in your blood pressure during the first week of therapy. Especially this reduction in blood pressure is observed when you change your posture. This condition is called orthostatic hypotension, and it can increase the risk of falls. That's why this medication should be started at the lowest dose possible. Your body slowly adjusts to this medication, and you may notice a relief in this condition. However, if you observe significant hypotension or falls beyond several weeks, then this medication may be discontinued. Abnormal bleeding. Duloxetine may impair your platelet aggregation. This may enhance the risk of bleeding, especially when duloxetine is combined with other antiplatelet agents like aspirin or anticoagulants like warfarin. Even analgesics like NSAIDs can also increase the risk. Therefore, closely monitor any abnormal bleeding events that happen to you. Nasal bleeding, discoloration of skin due to pooling of blood under the skin, and blood in the urine may indicate severe bleeding events. Abnormal behavior. Just like many antidepressants, duloxetine can also induce abnormal behavior and suicidal thoughts. Particularly, it is more pronounced in young and adolescent people. Therefore, when duloxetine is used in people with age groups between 18 and 24, caution should be taken to monitor their behavior. Symptoms like irritability, aggressiveness, agitation, and restlessness may indicate an abnormal behavior. Loss of sodium. Duloxetine can increase the excretion of sodium from your body. This may result in a few symptoms like confusion, weakness, headache, and impaired memory. Duloxetine can inhibit the activity of antidiuretic hormones in our body. This enhances diuresis, leading to loss of sodium. Loss of sodium may be more pronounced in people who are taking diuretics like furosemide or thiazides. When your serum sodium levels are reduced below 110 millimoles per liter, this drug should be discontinued. When to avoid. Duloxetine is not recommended with an antibiotic called linezolid. This antibacterial agent shows the mild inhibitory activity of one enzyme, monoamine oxidase. This reduces the metabolism of monoamines like serotonin, leading to their elevated levels. When linezolid is combined with duloxetine, it can precipitate serotonin syndrome. Therefore, it should be avoided. Duloxetine is also not recommended in people with narrow-angle glaucoma as it increases intraocular pressure. Drug interactions. Duloxetine is metabolized in the liver. A few medications can interact with duloxetine and impair its metabolism. Metabolism of duloxetine is carried mainly by two types of cytochrome P450 enzymes in the liver. One is CYP1A2 and another is CYP2D6. A few medications like fluvoxamine and ciprofloxacin can inhibit the activity of CYP1A2 enzymes. Similarly, other medications like quinidine, fluoxetine, and paroxetine can inhibit CYP2D6 activity. Therefore, these medications can increase the levels of duloxetine when they are used simultaneously with it. These are the important facts about duloxetine, a medication that has wide clinical uses. With careful monitoring and proper dosage, this medication can be used safely compared with a few other antidepressants. That's all, guys. Thanks for watching this video. Have a great day.